My name is Jane Murray. I participated in the diabetes group where we met for several weeks every Monday, and we talked about our diabetes and how to handle it. My doctor recommended it to me, and I was very happy to have that recommended because I didn't realize it existed. So it's a good thing to have the doctors recommend that to people. I liked the idea of learning more about diabetes. I wanted to see if there was any tips or tricks I could pick up, maybe some information that I hadn't gotten before from my own searches on the web, and just basically whatever you guys were going to offer to me was what I was looking for. I really enjoyed everything. We had some good stuff. We learned a lot about like how to eat properly, what to do if you're sick. I had never even thought about having a sick day plan with your doctor, but we talked about that, and we talked about how to handle like depression and when you don't feel like doing anything, when you're lacking your motivation. We talked about our medicines. We just covered just about everything you could think of, and it was all so interesting. And we had some speakers come in, and it was just enjoyable. I really had a good time with this class. Well, not really challenges with the program. I still have challenges with my own personal self-discipline and motivation, but I think I'm doing a lot better than I was when I started the program. They really explained a lot of it to me and helped to kind of get us motivated to where we understood why we needed to do things like eat right and exercise, instead of just kind of sitting around and going, oh, I've got diabetes, everything's over with now, I might as well just give up. So I've got a little bit of motivation under me now. Okay, I've learned the little method of how you do your plate, where you divide it into sections and you have a certain amount of vegetables and then a certain amount of meat and a certain amount of starches, and you've got your fruits and your condiments and stuff. So I do that. I try to do that with every meal. I don't always succeed, of course, but I try. And we talked about just getting out there and moving around, even if you don't do a whole lot. If you don't go out for an hour or 2 hours, at least go out and just walk around the block or walk around the mall, or, go to the gym and get on the treadmill for 15 minutes. Anything will help. So I've been trying to do that more often and just get moving. So that will help keep my blood sugar down. My sister is, she's also diabetic, and she walks a lot. And she says when she doesn't walk, her blood sugar, she can tell almost immediately it's going to go up. So that's why I've tried to start walking more. I think I would ask them, do you understand your medication completely? And do you have a sick day plan? And if they could not answer either of those questions positively, I would say, you need this program. Because I feel like people know what they should eat, basically. They may not know exactly, but they basically know, okay, I need to cut back on the carbs. I need to start exercising. But the thing about the sick day, I hadn't literally not even thought of that. It never occurred to me that maybe my diabetes would do differently if I was not well. So I think that's very important for people to understand. And it's important to know what your medication is for, not just for my diabetes, but what is it doing? What is it? How is it helping your diabetes to get better? Of course, there's no cure for it, but I think if you understand what's going on and how it's working, you're much more likely to succeed at keeping it under control.